Good evening. Thanks for always staying with Lagos Television. You're watching Sound Health. I am Ola Sumbo Modupe. The Nigerian Center for Disease Control and Prevention recently issued a public health advisory following the outbreak of Ebola virus in Uganda. It says Nigeria has been assessed as a high-risk country following this development. Today on the program, we'll take a look at the emergency response plan by the NCDC. Please stay tuned. The conversation begins after this break.
I think we're coming down the mountain, but the danger is when you're coming down the mountain, it's usually in the evening time and the light is bad and you're very tired. In fact, more people hurt themselves coming down mountains than going up mountains. Yes, there is an end in sight, but there's also great danger in complacency. There's a danger in becoming overconfident that this is just going to fade away. We need to remain vigilant. We need to keep in place the tools that we know work. We need to maintain that focus and that perseverance and that determination to keep mortality as low as possible. And if we keep doing that, yes, we will get to a point where COVID becomes another respiratory disease, probably settling into a winter pattern. But it won't go away as a public health problem. I honestly don't believe it will. I think it's here to stay in the sense that it'll become another circulating virus like RSV, like influenza. And we'll just have to keep.
It is still Sound Health on Lagos Television. Joining us via Zoom from the Nigerian Center for Disease Control and Prevention headquarters is Dr. Yahya Disu, the head of communications. Good evening, Dr. Disu, and thanks for always obliging us.
Good evening. Thank you for having me.
All right, Dr. Disu, quickly tell us, share with us the recent updates on Ebola virus.
Well, in the last, the current outbreak started September 2022, when it was reported from Uganda, some mysterious deaths that were investigated and confirmed to be Ebola. Since then, the country has been battling with Ebola, and it has affected about 8 districts, including Kampala. But I think they have been on top of this. Cases have been coming down, contact tracing and follow-up has been done, and the treatment is being given to those people who are confirmed, even though some deaths have been reported. But as of 1st of November, there was a new case confirmed from Kampala that was linked to a known case. So that new case is not a fresh case that we can think maybe it's coming from animal to human transmission, but it's still the current Ebola outbreak that is being reported. So, but I think the Ministry of Health of Uganda and their partners are doing a good job to ensure that things are under control.
All right, Dr. Disu, I'm sure viewers are wondering, just like other people and just like other resource persons and key stakeholders around the world, why are we seeing a resurgence in Ebola now?
Well, diseases have been part of nature, and because they are microorganisms that are also existing in their own natural environment. For instance, there are viruses that live among animals. And as soon as these animals get in touch with man and the necessary conditions for transmission is provided, then these viruses will move from animals to human. We call them zoonotic diseases. And there are many factors these days that we can say can be attributable to increase in zoonotic transmission from animals to humans, which include climate change that is altering the environmental conditions that favor transmission, and the breeding of these agents, as well as urbanization, and whereby people are encroaching the habitat of these animals because they are trying to expand communities. So this continues to bring us in close contact with them. Then again, farming, hunting, and all those things that continue to exist, some for hobby, some for business, economy, and this continues to bring us in contact with animals. And you will know that some parts of Africa are in thick forest zone where you have a lot of wild animals that harbor these agents. And then those countries that in that belt are prone to having diseases like this. But the important thing is the advancing sciences that we already have to be able to detect this and then put control measures in place to ensure that we contain them. The One Health approach is an intervention that the globe is championing now to ensure that stakeholders in animal health, environmental health, and human health work together to quickly detect and contain the zoonotic transmission of diseases. So the resurgence we are seeing is something that will continue to occur as long as we have right environmental conditions. That is, we as stakeholders need to work together to ensure that we triumph over these agents.
All right, it is a zoonotic disease, like you pointed out. Can you please share with us some of the symptoms? Are the symptoms similar to other zoonotic diseases?
Symptoms of Ebola similar to other zoonotic diseases,
yes.
If I got you right?
Yes.
Yes. Well, generally speaking, from medical perspectives, most illnesses present with general symptoms. That is infectious diseases, like fever, headache, general body weakness, vomiting, stooling, and so on and so forth. So they are common to any infectious disease, like even if it's malaria, be it typhoid, be it pneumonia, and then be it Ebola, viral hemorrhagic fever, Lassa fever. Although there are some specific diseases and specific symptoms to certain diseases. Like for instance, viral hemorrhagic fever generally, where Ebola belongs to, the terminal signs and symptoms include bleeding from different parts of the body, and by the time it's getting to this stage, the case fatality is very, very high. So that's what you can use to distinguish it from the others. For instance, if it is a zoonotic disease of respiratory origin, then you have respiratory symptoms. But Ebola does not have respiratory illnesses, unless if you have what we call overwhelming infection that affects all the organs, and then including the lungs, and then of course, such a person could also come down with symptoms that is compatible with respiratory illness. But usually that may be at the terminal stage or very late stage of the disease. So fever, headache, like I mentioned earlier, general body weakness, stooling, vomiting, these are things that you can see, sore throats, and so on and so forth.
All right, is this disease treatable?
For now, it's a viral illness. Viral illness generally are meant to be self-limiting. Though some may be devastating, like Ebola, and it does not wait for someone to fully recover before it takes life. If such a person can be given some support, we call it supportive treatment, in order for them to build their own immunity to eventually overcome this. However, there are some medications since Ebola outbreak in Liberia, Guinea, and Sierra Leone, about close to 10 years ago now, still less than 10 years. There are medications that have been tried that have been proven to be very effective against this. In addition to the vaccine that was also introduced. Although this strain of the viral has no vaccine to contain it yet, but I'm sure the scientific community are doing the necessary thing to ensure that there is also vaccine for this. But generally, supportive treatment is what is given. The earlier you get to supportive treatment to sustain one until one is able to overcome this fully, the better for outcome of the disease. Viral illnesses are generally self-limiting, right? But then the nature of the viral illness will determine the outcome of the disease. If it's a severe one, before one builds antibodies to overcome it, it will have taken someone's life. But if it's a mild illness, and one will have the opportunity to stay long enough and to build immunity to be able to fight the virus. So because the viral illness is always like that. I now said, however, and during the last outbreak in Liberia, in Guinea and Sierra Leone, and then subsequently in DRC, some medications have been tried and have proven to be effective against this virus. And so they are in use. And also vaccines have also been developed for Ebola virus. However, but the current strain, Sudan strain of the virus that they are experiencing in Uganda has no vaccine effective against it. So I know that effort is being put in place in the scientific community to ensure that they're also able to develop vaccine, but I don't know how far that is now.
All right, so is there any public health advisory to stick with or adhere to stay safe at this time?
Yes, public health advisory includes one, focusing on where you have this virus, and people who are close to where the outbreak is taking place are at risk and they are vulnerable. So they need to take all the necessary precautions with regards to hand hygiene, personal hygiene. They need to wash their hands frequently, wash their foods because you don't know what is contaminated. Clean your environment so that in case your environment is contaminated, and then you don't eventually get the disease. If they see anybody who has symptoms suggestive of this Ebola, then they should call the health authorities whereby they will make necessary arrangements to ensure that they get tested to confirm the disease and isolate them to prevent them from spreading it to others, as well as treat them promptly. And then because if you can contain it in people who have it, then we limit the risk of it spreading to other people around. And then for those who are far away, if there is no need for you to travel to where outbreak is reported, then you don't go. Avoid non-essential travel so that you don't cause trouble for yourself and others. So that's what we will say. Then if at all one has to go there, and then you have to comply strictly with those protocols that is given. And if anybody is coming from that place to a place like Nigeria now where you don't have cases, you need to declare to the health authorities that, oh, you've been in this place in Uganda, or you passed through that place, so that they can follow you up for 21 days, and after which they will discharge you if you show no symptoms. And the essence of that is if the person is showing symptoms and the person has the virus, the person will be detected early to prevent it from spreading to others. And we all need to be vigilant, as in watch our backs and then ensure that our colleagues that have recently traveled to this country, they comply with the health authorities protocol, and then to also support them to be able to ensure that they comply with those protocols, and then to report in case they have symptoms. And we just need to continue to educate ourselves, pass this information to those who don't know, and then so that everybody will be on the same page. So for healthcare workers, they need to be vigilant and show high index of suspicion because they should not just take for granted people that come to the hospital, and they need to find out the history of travel. In case somebody has gone to Uganda and you're able to get that, then and the person is showing symptoms, you can quickly make sure that you isolate the person, as in you call the health authorities, the state ministry of health of that state, or the disease surveillance officer, who will come and take over from there. We don't even encourage them to refer on their own for these people to go by public transport to health facility, because you can contaminate the public transport and then it will now become more difficult to control this outbreak. So wherever we find the case, they stay there, we call the health authorities, and they come and take over from there. and then we ensure that we don't stigmatize, so that those who show the symptoms don't go underground and cause more trouble for this.
Nigeria has been assessed as a high-risk country. What does this mean for the country, and what are the emergency response preparedness plans in place?
Yes, the high risk, after the declaration in Uganda, Nigeria quickly, that is NCDC, through the EVD-TWG, that is Ebola Viral Disease TWG, meant to conduct a risk assessment to look at what is the risk of this coming to Nigeria. If it comes to Nigeria, what is the risk of spread of the disease in Nigeria and the potential impact of this in the country. So, and they did that, and they found out that it is high because of travel from Uganda to Nigeria. And people travel, some transit through Uganda, some Nigerians travel to Uganda and come back. And so, that means that let's face the reality and actually prepare for this in the case of any eventuality. So, and that's what it is. But what Nigeria has done, mainly first at the point of entry, to scale up surveillance, and then to ensure that people who are arriving from Uganda, questions are asked about their potential contact with a potential case or a confirmed case, and then they are followed up for 21 days wherever they go in the country to ensure that they are symptom-free. In case they become symptomatic, they pick them up. And then, of course, all the states have also been alerted, the State Ministry of Health, and then to make sure they prepare. Luckily, we have all the treatment centers prepared in country, even though there are specific requirements for Ebola treatment. So countries, states with high risk of getting this disease have also been alerted. Standby rapid response team have been in place that can be mobilized to support those states in case they happen. And just like what we're doing now with communication and community engagement, to ensure that people know what the symptoms are and where to report to. 6232 is the short code for NCDC, that anybody can call if they see any strange or they notice any strange illness that may look like Ebola or any other infectious disease, so that they can get advice from that. So, and the laboratory, we have laboratories in Nigeria that can confirm Ebola, our national reference lab, and also the lab in Lagos, that's the University of Lagos Teaching Hospital. So, and then case management team have also been trained to be ready. And definitely we have some people who have experience in country who can be mobilized to respond to this. Our cumulative experience from Lassa fever and the current outbreak response have also been an advantage for us in country.
All right. I would like you to say again the toll-free line you just mentioned. Did you say 6362?
6232. It corresponds to the acronym of NCDC.
Dr. Disu, is this a test of what we've learned from the COVID-19 outbreak?
Well, I won't say it is a test because it's a continuum. Outbreaks occur, they are part of our experience, and we continue to build on the experiences of managing the previous outbreak for the next outbreak. If you look at what we do today, mainly was lessons we learned from Ebola outbreak in 2014. And we're able to build on that to continue to respond to Lassa fever, meningitis, and the yellow fever outbreak, and so on in country. And over time, we've been able to build the experience that help us to be able to combat COVID-19. And we've also learned many things from COVID-19. We've strengthened our infrastructure, built capacity, learned new methods of containing outbreak, use of technology like use of electronic surveillance system in country, whereby disease surveillance reports real time. So all those things have really prepared us to rapidly respond and effectively to outbreak, whether Ebola or any outbreak.
Dr. Yahya Disu, Head of Communications, Nigerian Center for Disease Control. Dr. Yahya Disu, Head of Communications, Nigerian Center for Disease Control and Prevention. Thank you so much for your time and expertise on the show.
Thank you for having me.
All right, I have been speaking with Dr. Yahya Disu, Head of Communications, Nigerian Center for Disease Control and Prevention, on the level of preparedness for the Ebola virus outbreak in Uganda. Sound Health continues with trending health report from around the world. Please stay tuned. This is where we say thank you on today's episode of Sound Health. Remember, you need to report symptoms early enough to the nearest health facility, or you can also call 6232. It's a NCDC toll-free line. You definitely get help when you call. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.